Now, the pink sheet with your pink packet, if you look on here, obviously there's other handouts in that packet that will help you if you read them. But if you look at the pink packet, we have our favorite, our incentive spirometry. And here we know that Shelly's crazy ass wrote, suck the balls, okay? So you know that your little patient, when you go in there, they're going to have to inhale to do this. So on the pink packet, let's look at all the stuff you better be highlighting. Number 1, it talks about started within an hour after surgery. Is everybody looking at that? Okay, let me help you with this. Some of you are spoiled, and I ain't mad at you because you got enough shit to do. If you work in a major hospital in this city, a bunch of them, there's a bunch. We're blessed, we have 1 million hospitals. But if you work in a hospital in Cleveland, you're probably going to have respiratory therapy take this over for you. They're going to come in the room, they're going to show the patient how to do it, they're going to help the patient do it, they're going to come back and check up on the patient doing it, they're going to check up every day on the patient doing it. You're spoiled. If you work somewhere else smaller, or you work in a unit where respiratory therapy don't hang out in maternity, it is my nurse's responsibility when I'm done with a C-section to do incentive spirometry with that massive abdominal surgery patient. They don't know how to do it. I literally, physically hear them say, honey, you need to blow in this machine. No, you don't. You have to inhale and keep the ball up. It's not even as simple as get it up. It's like you got to keep that little gadget, that little yellow ball. You got to keep it up as long as you can. And I want you to write this. I want you to write this number for how long you should keep the ball up. You see where it says patient should use it 10 times every hour? And above that, it says inspire higher to keep the ball up. Put on that part right there by holding their breath for up to 6 seconds. So it says inspire higher to keep the ball up, and you're going to finish the sentence by holding their breath up to 6 seconds. She's trying to keep the ball up. Now remember, the patient is in high fallers and they follow it with a cough. What's the goal of incentive spirometry? What are you trying to do with it? Prevent atelectasis. It's on here. I wrote it. Prevent atelectasis, which is a little precursor for pneumonia. Okay, you kind of got to know that. Pursed lip breathing. This is, and I don't have to teach this because you can read it. It's real easy. But the reason for it, I would want you to highlight. Pursed lip breathing is done with COPD, and you're blowing off excess CO2. Now, O2 therapy, oh yeah, that's big. So let's do some O2 therapy. We did our pulmonary hygiene. We talked about liquefying secretions and sucking in and all that. Okay, let's do our little O2 therapy. Big deal here. Y'all already know where I'm going. The patient who needs oxygen at the hospital or the long-term care facility may be in respiratory distress. Ain't that right? And y'all already know what that means. Let's just give you 2 things that you have to know. You absolutely, positively better walk up out of here knowing that a pulse ox less than 90 or a PaO2 less than 60 is your gold standard for respiratory distress. And you don't need both. You just need one or the other. Now, I can give you the rest of the song, but you already know it. I ain't going into that. But the part of the song that matters most is those 2 things and the word restlessness. Don't forget behavioral terms, babies. Don't forget that the patient in respiratory distress is going to be restless. They're going to have anxiety. They're going to be agitated. They're going to be apprehensive. They're going to have a feeling of doom. They're going to be irritable. One of those words is describing what their behavior is. And those are called behavioral terms. I could add more. I could say confusion. I could say altered LOC. I could go on and on and on and on and on. But the point I'm making is the reason why your patient has agitation, apprehensive, anxiety, irritability, confusion, altered LOC, feeling of doom. The reason why they're restless is because there's no oxygen getting to the brain. And the brain is going to give you an early subtle warning because the patient's going to act differently. That's really more important than the pulse ox. This anxiety, apprehensive, agitation, restlessness, feeling of doom, all this shit is more important even than the pulse ox and all this other stuff. Okay? When nurses miss that beat, you kill people. Okay? Y'all fight? Okay. Now, so all that shit is there. Okay? You added your behavior terms, but the pulse ox less than 90 and the PaO2 less than 60 and all that shit is there. Okay? Now, what you want to do is you have one more thing. When we have a patient on oxygen in the house, we order it continuously, and if you go down the list, you'll see something, little bubble, says home therapy continuous if the PaO2 is less than 55. So we're going to send you home on oxygen. If you're going to be in that low, okay? Now, some rules. Let's do our rules. Let's go down the list. Start at the top. We got to put an oxygen sign on the hospital door. We also have to remember we need a sign on the house door. Because the firemen, if there's a fire, you best believe they need to know there's oxygen in that house. So they need a sign on the front door. Now, this is where practicality comes in, because you have to remember our elderly in America are different from elderly anywhere else in the world. The elderly in America live alone, and that's sad in and of itself. But because they live alone, and a lot of them are on oxygen, I have had them tell me, oh, I don't know, Shelly, I don't want to put that oxygen sign on the door, because then people will rob me. And they're absolutely right. Because if you're vulnerable and you're on O2, I could break into your house and there's not a damn thing you're going to do about it. Because you can't. That's real. Oh, I don't know. I live in a bad neighborhood. I don't want to put that on my door. Then people are going to know I'm sick. That's real. So reality is you have to understand your patient. You can't be in your textbook all the time. Oh, well, you got to have an O2 sign on your door. Well, you do have to have an O2 sign on your door. She's clearly telling you on 55th and Kinsman, it's not a good idea. Okay? And that's just real. I'm all right with that. Okay? I think the chances of the fireman having a problem and the chances of her getting robbed, we got to weigh it. Chances of her getting robbed, weigh up. Okay? All right? Now, the rest of this, nasal cannula, look what I wrote. If it's in capital letters, it's important. No more than 6 liters per minute. Also, I put them in order. I wanted you to remember if it's full, flat-out respiratory distress, how many liters of oxygen do we need to put it all the way up to? Above that, above the nasal cannula. 10 to 15. And what kind of mass we got? And what does a non-rebreather give me? Give me 100% O2. Non-rebreather gives you 100% O2. It's as close to that as everything else is nowhere near 100%. The non-rebreather is close to 100%. It does need to be, when you see the words rebreather on your chest, it needs to be inflated. No matter if it's a partial rebreather or a non-rebreather, they got to be inflated. Venturi mask, you already know this. It's going to give us precise low dose amounts of O2. So I could get with the Venturi mask 1.82 liters. It's precise. Now, I know you know this, but your patient does not, so don't underestimate how important it is to go over it. No Vaseline. What do we use instead? Aloe vera gel, or, write this in, water soluble jelly. You and I know it as KY jelly. It's not going to be a brand name. It's water soluble jelly. Liquid O2 burns the skin. That's on there already. Home therapy we went over already. And there's one thing that I want to amend for you. Do you see where it says may store flat under bed? That's what your patients do. On your exam, I need you to write something up on there. Store, on your exam, I want you to write, store tanks in upright position. I want you to know, store tanks in upright position. Okay.
Should we cross out the...
No, just understand it's realistic for real people. They don't have any space. They put them up under their beds. They do. Okay. Whole lot of people do that. But for your exam, store in upright position. Now, stay 6 feet away from every damn thing. You shouldn't have no electric razors, blow dryers, electric toothbrush, heaters. Nothing should be by oxygen. So if you got oxygen on, you're not blow drying your hair. You're not finna use an electric toothbrush. You ain't finna do no electric shave. Not with that oxygen in your nose. No, you're not. Okay, watch the space heaters. And always remember in the back of your mind, space heaters are the #1 cause of fires. Now, we say keep the sign on the door. Have a backup tank. Call for a new tank if 1/3 full. That's true. Okay, so all of that kind of stuff, you guys know. But it's a big deal, so you want to really read that kind of stuff. If I spelled it all out like that, it's big.